Jason's hands rest on the armrests of his power wheelchair. The rubber grip is worn smooth where his thumb has worked it day after day. He does not look for drama when he speaks, but the question that has followed him for years is sharp enough to cut through any calm moment.
He asks it slowly, as if you might really hear it for the first time. They say I cannot have Medicaid because I do not work. So how am I supposed to work? Then he adds the part that makes the contradiction impossible to ignore. I cannot work because I am disabled.
Jason is not speculating about his situation. He is on SSDI, Social Security Disability Insurance. That means the federal government reviewed his medical records, evaluated the evidence, and made an official determination. He is too disabled to work.
That decision is not a suggestion. It is a legal finding. It is written down, filed, and recognized across the country. So, Jason wants you to hold two statements side by side and ask whether they can possibly both be true at once. First, the federal government says you cannot work. Second, the state of Georgia says you must work in order to keep your health coverage. When you place them next to each other, the logic starts to fail, yet the policy continues. Medicaid, for most people, is simply health insurance. It pays for doctor visits, medications, and preventative care. It is funded together by the federal government and the states, and each state has some control over how it sets eligibility rules. In Georgia, one of those rules became the centerpiece of a system designed around a work requirement. Georgia requires certain adults who are otherwise eligible to demonstrate that they are working, volunteering, participating in job training, or completing another approved activity for a set number of hours each month. In plain language, if you cannot document enough work activity, you risk losing Medicaid, even if you are disabled. Supporters of the approach argue that it encourages independence and keeps people engaged. Georgia also tells residents there are exemptions for individuals who are truly disabled. On paper, the state provides a way out. But the way out is not a door that opens easily. The exemption process requires documentation, it requires forms, it requires proof that must be collected and submitted on time. It requires appeals if the decision goes the wrong way. It requires follow-up, again and again. Because eligibility rules do not pause for illness, and systems do not slow down for human limitations. Jason has watched what happens when the documentation is incomplete, when a notification is missed, when a medical report does not arrive in the format the state requests, or when a caseworker cannot process the paperwork fast enough. In many situations, the result is immediate and final. Coverage ends, not after a thorough, compassionate review, not after time to recover or to coordinate care. Full stop. For someone with conditions that affect thinking, mobility, vision, stamina, and daily coordination, paperwork is not a neutral task. It can be a barrier that behaves like a wall. And the reason Jason uses that metaphor is simple. He has felt the weight of it. He is disabled because his body changed. He has had 3 strokes. He lives with Behçet's disease. One eye has near total loss of vision. These are not symptoms that can be scheduled around. They are not inconveniences that disappear with motivation. They affect how long he can sit upright, how reliably he can read and interpret instructions, how steadily he can manage appointments, and how safely he can travel. Jason is emphatically not lazy. That point matters, because the work requirement narrative often paints disabled people as people who are choosing not to try. Jason's history is the opposite. He worked for years, built a career, and paid into the systems that are supposed to support people when health fails. He did not opt out of working. His body did. The chair is not a choice. The disability is not a negotiation. The question is not whether he deserves care. The question is whether Georgia's policy is allowed to punish people for the very thing the federal government already recognized. And that brings you back to the central contradiction. Georgia says he cannot have Medicaid because he does not work, even though the federal government has already determined he is disabled enough that working is not possible. To understand how Georgia got to this point, you need to understand one more policy decision. Under the Affordable Care Act, States were offered an option to expand Medicaid eligibility more broadly. Many states accepted it, covering far more low-income adults. Georgia refused full expansion and instead created a more limited program, commonly referred to as Georgia Pathways. Georgia Pathways did not simply provide coverage, it attached additional conditions, especially the work requirement structure. That means people are not only dealing with restricted coverage, they are also dealing with rules that increase the likelihood that they will lose benefits despite qualifying medically. If you were trying to picture what that means for a real household, consider the stress of receiving a notice while living with illness. Imagine trying to gather documents while symptoms flare. Imagine navigating deadlines while your energy is unpredictable, while vision limits what you can read, and while transportation to appointments might already be difficult.
Now, imagine that missing even one step can erase coverage.
This is not hypothetical. Similar work requirement programs in other states were evaluated, and the findings were consistent. They did not move disabled people into employment. They did not transform health limitations into stable work. What they did accomplish was devastatingly practical. Thousands of people lost coverage, often for reasons unrelated to whether they could work medically. Sometimes people missed a check-in. Sometimes they could not submit paperwork fast enough. Sometimes the online system failed or the process was too complex. Sometimes the required documentation simply could not be obtained in time. When coverage was tied to meeting administrative requirements, the administrative failures were what mattered, not the person's actual disability status. That is why Jason describes the policy as something more than red tape. In his experience, it functions like a trap door. You can qualify medically and still fall through because the system demands compliance with processes that do not respect the realities of disability. Now consider the downstream effects, because healthcare policy does not stay on paper. When Medicaid is lost or when it becomes unreliable, specialist care becomes harder to access. For Jason, that has real consequences. Specialists are often the difference between stabilizing a chronic condition and letting it deteriorate. Preventive monitoring catches complications early. Follow-up care adjusts treatment before symptoms become crises.
But without Medicaid, Jason cannot consistently access the specialist attention required to manage conditions like his. When that monitoring slips, problems that should be detected early can go unrecognized. Symptoms that might have been controlled can progress. What begins as manageable can become an emergency.
And when emergencies arrive, the most expensive kind of care is often the only kind available quickly. Georgia is not simply shifting costs, it is shifting responsibility. In practice, the state may prefer preventive goals in speeches, but the system they built can push people toward emergency rooms instead of regular care. Emergency care is typically far more costly than preventive or routine treatment. And then comes the final irony. Emergency care costs are not absorbed by someone else. They are passed through the healthcare system and ultimately affect taxpayers. So when Georgia refuses to make coverage stable for disabled residents, it often ends up increasing the public financial burden while also increasing suffering. Jason also finds it difficult to accept the moral framing of the work requirement. Advocates frequently talk about fiscal responsibility and protecting the taxpayer. Yet the logic becomes questionable when you look at what the policy actually produces: lost coverage, disrupted care, delayed treatment, and emergency-driven outcomes. A system that increases emergency utilization may appear disciplined in one narrow accounting category, but it can be expensive overall, especially when preventable complications are allowed to escalate. Jason has watched this cycle repeat itself through changing policy language and stricter enforcement. He has been in his wheelchair since before the most recent coverage restrictions tightened the path ahead of him. Over time, exemptions have become harder to obtain. Paperwork has multiplied. Deadlines have felt less flexible. Appeals can take longer than a person's health can comfortably spare. The result is that disabled residents are asked to prove their disability in a way that is administratively burdensome, medically ironic, and emotionally exhausting. The state legislature continues to vote to keep the structure in place, often while speaking about personal responsibility and the dignity of work, words that do not fit the reality of someone who cannot stand, cannot reliably see, and cannot safely navigate each month's administrative demands.
If you are disabled in Georgia, you should not interpret this as personal failure. This is a designed outcome. The system is working the way Georgia built it to work.
The question is whether you will tolerate it as normal. Jason does not ask for charity. He asks for stability and fairness. He asks for Medicaid coverage to reflect the federal determination already made, that he is disabled enough that work is not possible. He asks for a system that supports people's health needs rather than requiring them to beat an administrative clock.
Because health conditions do not pause while forms are processed. Disabilities do not become less real when websites do not load. Illness does not stop long enough for a caseworker to return a call.
If this has felt familiar, if you have received notices, faced deadlines, tried to submit documentation while coping with symptoms, or watched your coverage slip away, Jason wants you to know you are not alone.
And if you are watching this and you feel anger, you are not wrong to feel it.
You are recognizing a contradiction, a federal disability determination paired with a state policy that treats disability as something you must work around to deserve care.
Share this video with someone who needs to see it. Tag a friend, a family member, or an advocate who has been affected by Medicaid instability in Georgia.
And if you want more clear reporting on how these policies play out in real lives, subscribe to Rolling Disaster, because these are the fights that determine whether people receive health care when they need it most.